Hi everyone, I'm Alicia, and today I'm joined by Dr. Bilski from Bilski Dental Group. How are you doing today?
Good morning, good.
Good. So in this video, we're going to be talking about lasers to remove lumps that we have in our mouths.
Mm-hmm.
So I'm just going to turn that over to you. What can you tell me about that?
Probably the two most common lump removal procedures are fibromas and mucoseals. A fibroma is about the size of a number 2 pencil eraser.
Okay.
That's a traumatic, you bit yourself. It's usually on the side of your cheek, on the inside, or right here up front on the lower lip.
Okay.
So the fibroma is traumatic. It just kind of fills up and stays there, and it's very taut. It's not movable. It's clear in color, very similar to that. So it resembles the other tissue. It's not red. It's not white. It's just there. Now I'm actually pulling on the lip to show you the extent so we could get a nice view in the camera. What we're going to attempt to do here is use a CO2 laser.
Okay.
And what that CO2 laser does is it incises the tissue. Now I'm, again, pulling on it so it looks bigger and worse. Looks like a cigarette burn.
Right.
However, the laser at the low energy, it actually cauterizes nerve endings, blood vessels, and the lymphatics that are in that area. So it's searching for water. It's dehydrating. It is removing the lump, which in this case was a fibroma, and cauterizes, so there's no stitching. There was a little bit of Novocaine utilized in this procedure. And usually within about 7 days on the inside wet part of your lip, it heals very quickly.
Wow. Okay.
Another another lump that we utilize to eradicate called lesion destruction. It's not cancer. That fibroma was not cancer.
Okay, that was something I was going to ask, if it had to be cancerous or just...
That's a good point. Let's go back. Doctor, I got this lump on my lip. I have to come in. I think it's cancer. And there's so much cancer available on our websites and our news all the time that is a huge concern. And most every time, I've not had one yet that has been cancerous. We do biopsy. That's by law. I have to send it to a laboratory and they check it. So the fibroma. And the other one is a mucosal, which looks similar. Okay. But in that case, it's a little bluer or purpley. And there are salivary glands. And the best description I can give or analogy is picture a bunch of purple grapes. Okay. All right. And it's a little fibroma, and that's as big as a number 2 pencil eraser. It's not that big. But those salivary glands, the grapes, are injured. You bit in them. And they swell up, and then they go down. They swell up, and they go down. So that may go on for a year, 2 years, 10 years. Then eventually you bite into it, and it bleeds a little bit, and it stops. Now you're just annoyed. It's just not going away. So you come in, we do the same thing that we do with the fibroma. We just laser it, non-contact, dehydrates everything, cauterizes the nerves, cauterizes the blood vessels, cauterizes the lymphatics. No swelling, no post-op pain. Advil, Tylenol if you're worried about it. There's no opioids. We have to worry about that. You don't have to do special rinses. You don't have to do anything.
So it's not something super severe. It's usually just something that's annoying. You know, you bit your lip time and time and time again, and it's just, you're done.
We schedule for less than an hour appointment. You're in and out of the office real quick. We send it to the lab and get a report back in 7 days.
Just to make sure.
And we always call back and say, hey, look, it's nothing. Don't worry about it. We don't just... Like you said, no news is good news. No. You want to know
you want to know,
news.
Especially, something like that in your mouth.
Absolutely.
So, wonderful. Well, thank you so much for telling me a little bit more about that. If that's something that you are looking for and you'd like to contact Bilski Dental Group, you can call them at the number on this screen to schedule an appointment with Dr. Bilski, or you can visit them online at bilskidds.com.